Greetings. Let me take this opportunity to share with you the beautiful structure of an endoscope that has revolutionized the care of patients with gastrointestinal diseases, whether it is control of bleeding, opening up an obstructed lumen, removing polyps, or taking out stones. So let's look at how we do a colonoscopy. So here is an endoscopist who is holding the endoscope in the left hand and then gently pushing the insertion tube using the right hand into the rectum. He is assisted by a nurse and an endoscopy technician. This team is critical for a good outcome of any procedure. So let's look at the endoscope in a little more detail. How does this help the endoscopist to put in air so that we could distend the colon, flush in water to clear the lens if it gets a little bit dirty, suction out the fluid in the colon, and then steer your way up the tortuous colon to reach the site. And finally, how does one take pictures and biopsies of polyps? So here is an endoscope. It has a control section, an insertion tube that goes into the rectum of a patient and up the colon, and an umbilical cord that is attached to a processor that delivers light, has a camera that can take pictures, allows to put in air and water, and as well as suction fluid. So the umbilical cord is attached to the processor. So let's look at the control section. It is quite complex. It has an air-water button, and if you gently occlude the air-water blue button, air comes out. Or in routine practice, we use CO2, and CO2 comes out through this channel. If you press it further down, water comes out of that air-water nozzle, and it is a small amount of water that can be used to clear the lens if it gets dirty. Next, if there is a lot of fluid in the colon that is interfering with the vision, you could press the suction button and you could suction the fluid out. And in the process, if the lens gets dirty, you can press the air-water button to clear your lens, and then if you gently occlude the lumen, you can insufflate air. So once you're in the rectum, as you go up the left side of the colon, there are multiple bends and you have to navigate those bends from left to right, from right to left, going up, going down, multiple twists and turns. And how does this scope help us get there? So here is an endoscopist who is trying to go and turn to the right side and then go up the left colon. So this is accomplished by moving the control dials. The control dials allow the endoscope bending section to move either to the right or to the left, up or down, and in addition there are locks to keep the bending section in a particular direction. Sometimes the colon could be loopy, and you could stiffen the scope by tightening the stiffness control. So, as you can see here, the scope has several different functions: ability to put in air, suction water, clear the lens, ability to control the tip and move it to the right, left, up, down, and even stiffen the scope. And using a complex list of maneuvers, the endoscope can be pushed up the colon, and as you go along, you may see polyps. So here is a polyp, and you may be wondering how an endoscopist looks at a polyp. The scope has a camera and light ports. So the light ports beam light, and the camera continuously records what we see inside the colon. So once you see a polyp, if you decide to freeze a photo like you use a camera, you press the button that is just above the suction button, and then if you want to capture, you press your thumb and capture and take a photo. You could also evaluate the type of the lesion with certain scopes by pressing another button that changes the color and helps us figure out whether it is a benign polyp or a cancerous polyp. And in some scopes, there is another function that allows us to use the scope like a microscope. So the near focus function by pressing the button on the back side of the head of the scope just towards the left. So we have seen that by using these different buttons, you can take pictures and also evaluate the lesion with chromoendoscopy and near focus function. So here is a lesion that looks like a polyp. It looks like a benign polyp, and if you decide not to remove and you want to take a small piece using a biopsy, and you may be wondering, where does the biopsy forceps come out? So there is an accessory port or a biopsy channel, and the endoscopist can pass a biopsy forceps down the accessory port that comes out of the biopsy channel. And this forceps can be used to take a biopsy. Now here, in summary, we have shown how an endoscope, with a complex design, has a light source, a camera, channels for air, channels for water, and channels for putting instruments and taking biopsies, and also ability to steer in different directions to get to the point and do the job. I hope this video is useful to you in appreciating this instrument that has been designed almost 50 years ago and still pretty robust design. And we should congratulate and thank the engineers that made it possible. I would like to acknowledge the support from Dr. John Stoline, Distinguished Professorship at the University of Texas, MD Anderson Cancer Center, Mr. Charles Butt and HEB for their grant, and Angela Deal for medical illustration. Thank you.